Hi, everyone. It's Leanne, and it's from the Heart Podcast. Today, I have Erin Kasparek, who is a naturopath in Ottawa and my naturopath again. And we're going to talk about vitamin D because just like it's a hot topic. And then throughout my career, people were always asking me what the references range were, and there wasn't a lot of known a lot of things known by the more mainstream kind of healthcare providers. And it's not that I'm like the one to go to, but I learned so much from Erin just by being her patient and asking her questions for myself and for my clients. And so I thought that it'd be great if I could ask her to tell us about what vitamin D is and why it's important, and what the controversies are as well, and the research and things like that, so that we can get the information from the person herself.
Thanks for asking me.
Yeah, thank you so much, Erin. Do you want to just start with what vitamin D is and what it does for us?
Yeah, sure. I mean, it has vitamin D. We call it a vitamin, like we call, vitamin C and vitamin E vitamins, but technically it's a hormone. So it got identified and it acts somewhat like a vitamin, but it's on like a cholesterol backbone. So like the chemistry of vitamin D is that it looks very similar to cholesterol with like a little tag attached. And that's what all of our steroid hormones look like. So like estrogen and progesterone and testosterone and cortisol, all the adrenal hormones. Officially, it acts a little bit more like a signaling molecule, like a hormone, than it does like a vitamin or mineral, which is a little bit more like a nutrition catalyst for our enzymes. But for whatever reason, it's slotted into vitamins. And so it falls into one of those fat-soluble vitamin categories. So vitamin A and D and E and K can concentrate in our bodies. They concentrate in our fat tissue. And they're the category of supplements that really we don't want to overdo, because the levels can build up in the body. It's not like we pee them out like B vitamins. And so that's sort of what vitamin D looks like, and the actions, we could spend 5 hours talking about. It does so many different things, but its most popular and sort of most important roles are to encourage calcium absorption through the intestine from our food, and in that way contribute to osteoporosis prevention and bone health, those things. Vitamin D also acts on the immune system, so it helps to regulate sort of allergy and all the associated eczema, asthma, etc., seasonal allergies, like an overreaction or like an immune system gone rogue, similar to autoimmunity. There's a lot of evidence showing that individuals who have low vitamin D status are more prone to have sort of an autoimmune disease activate following an infection or a stressor, or some sort of stress signal to their body. And kids with vitamin D deficiency tend to have a little bit more eczema and allergies, and they tend to be the sort of more immune fragile kids and then adults. And so those are the big two roles of vitamin D: the action on the immune system and the action on our bone. But there's also an entire role of vitamin D in terms of mood support and premenstrual mood changes, specifically depression. And I used to see a patient who would say, she would sit in the waiting room and say, I don't have depression, I have vitamin D deficiency. And she had tracked her vitamin D and blood work for years. And when she felt mood-wise low, her vitamin D always tracked low. And when she felt better, it was when her vitamin D status in her blood was higher. And so she had paid attention to that and come to the conclusion on her own. But that's the other sort of less commonly talked about role of vitamin D. And then vitamin D there's all these studies on vitamin D and pain threshold.
Mm.
So if our vitamin D status is low, we feel pain. We're more sensitive to pain. If our vitamin D status is high or optimal, we're more resilient to pain. So we might feel the same, or maybe the same like nerve pinch, or maybe the same like muscle twinge, but it doesn't hurt as much. Like we don't sense it as strongly, which is really interesting.
Yeah.
I can remember like a few, maybe, I don't know, it was 2017. I think I went to a naturopathic conference that was all about pain. It was like 2 days of speakers. And it was in some ways disappointing and in other ways like reassuring. All of the speakers talked about turmeric or curcumin extract as an anti-inflammatory, vitamin D status. And oh my gosh, it's like the third one is escaping me. There was like one other intervention. And then we talked a lot about acupuncture and stress and like the mind-body connection with pain. But there are very few supplements that help with pain levels. And vitamin D is like really up there in the research, at least.
Yeah. I saw an abstract or something that showed that women who had a higher vitamin D status used less pain medication in labor.
Oh, interesting. In labor. Oh, interesting. Yeah. I mean, that is interesting. Like in pregnancy, I mean, just like every other nutrient, like women's iron status in pregnancy directly translate to like their newborns' iron status. And then as if women are able to breastfeed, they can continue to pass some of that nutrition on to baby. And it's the same thing with vitamin D, like a woman's like vitamin D reservoir in her body, especially through milk, like it's a fat soluble nutrient, passes through. And so babies that are born to women who are vitamin D deficient tend to start out life with a lower vitamin D status. And like very few people are testing and like a 2-month-old, not doing blood work on a baby unless they're really sick. So you don't really, it's kind of like a guess. You can test the mom, but it's important in pregnancy to maintain like high vitamin D levels for the sake of like for you, but also and I suppose pain and labor management, but also for like babies' immune system outcomes.
Do you find that pregnant people or lactating people need to take more vitamin D than when they're not pregnant?
That's the recommendation. Like there's sort of a, if the daily recommendation for vitamin D through, the Canadian Medical Association, or, if the statement is 1,000 international units daily, which is usually like 1 gel cap or 1 drop, depending on like supplement form. Probably in pregnancy, more than that is warranted. But it really depends on someone's levels. Like sometimes I'm surprised by sort of Ottawa or like Outaouais dwellers, and some people have really like solid vitamin D levels because they spend more time outside. And so that's the other. Obviously, we can get vitamin D from a few foods, from supplementation. There's a medication version of vitamin D that's like 10,000 or 50,000 international units, like these much bigger doses. But when sunlight hits our skin, cholesterol that's floating around in our bloodstream gets converted into several forms of vitamin D. So not just like D3 or D2, like these common supplemental forms, but a whole host of very much like other hormones. Like there's variations, and they go off and do all their physiological actions. But that's really the best way to build vitamin D levels. And then mostly postpartum, I would say, especially with women. I mean, when women come to see a naturopath postpartum, they usually don't feel well. They feel really good. They're hanging out with their baby and going for walks. They're not coming to see me. But if they come in and they're really tired or they're really like experiencing a lot of mood changes, I often will test vitamin D levels and iron levels and vitamin B12 and thyroid. And sort of the trend is that everything is low. Even like white blood cell counts will drop. just the body's like so depleted from having like, given away a lot of nutrients and lost some blood, and
Mhm.
it's like a tough go. And so it takes time for like that postnatal repletion to build back up. And so it's a lot of pressure, but if for women who are like preconception or planning on getting pregnant and then in pregnancy, it can maintain good vitamin D levels. There's like less of a chance of like that dip postpartum.
Right.
Mm-hmm.
What's the difference between D2 and D3?
That's a good question. D2 is I would say like in the 80s, D2 was a supplemental form of vitamin D, and then it switched over to vitamin D3 when sort of more research picked up. It's not as active a form. It doesn't have sort of the same roles. D3 is like cholecalciferol. It's like the main form of vitamin D that's found in the bloodstream, or that has been found to act as a hormone. And so that's the form that most supplements are made with. Just it's like the convention. I'm not sure if it actually is the best form, but that's the conventional form. And beyond that, like we don't really have variations of vitamin D. Like our body, we don't have as much ability to identify all of those different forms that we make on our own. But as all things in nature, if we do it ourselves, it's usually like higher quality than if we supplement.
Right.
Like
Right.
simple versus complex if our
Yeah.
body's in charge of it.
In the winter, when we need to supplement, well, I need to supplement more. But like, what do you do, or what do you recommend? Yeah.
For a long time, because vitamin D, I find individuals are like fearful, very fearful of like taking too much of a supplement, and like for good reason. Like you don't want to poison yourself with vitamin D, and the risk of having too much vitamin D is that you pull too much calcium into the body, and then that calcium, you can only put so much calcium into like building your bone in every given minute. And so if there's excess calcium in the blood from absorption, the risk is that it goes to like the kidneys and forms kidney stones, which nobody wants, or that it deposits in the arteries and contributes to like arteriosclerosis and hardening of the arteries. Calcium can be found in the lining of the arteries, and that's obviously like not good for cardiovascular health outcomes. Or like in theory, calcium can deposit like around bones and form like little bone spurs around the spine or on the feet or wherever there's a lot of impact. Like calcium will go to areas that are injured or inflamed in the body, and so if there's excess, like it is not a positive thing. That's why vitamin D or vitamin K2 has become popular, because vitamin K2, it doesn't have any impact on like calcium absorption. It doesn't really do anything in combination with vitamin D, but it does tell calcium in the body, like, go to the bone. It's like air traffic control, like go specifically here and stay out of the arteries and out of the kidneys and out of other places you're not supposed to go. So vitamin K2, which is very different than vitamin K1. Vitamin K1 is a clotting factor, found in like leafy greens. But K2 is found in like fermented butter, like natto, fermented soy. And so not things that like we eat a ton of in North America traditionally. And that's sort of the explanation. Like why does North America and the UK have these huge rates of osteoporosis, and places where there's very little dairy, like cow dairy consumption, like Korea or Japan or China, why do they have lower rates of osteoporosis than us? Like maybe they're eating a lot of fermented soy products, like, or spending more time outside, or all of these things. Anyway, I got sidetracked. What was the question?
Actually, now you went through another thing. Now I want to ask you a different question. But vitamin D. I've always read it in conjunction with vitamin K and also vitamin A. So do you want to talk about vitamin A? It does.
I don't know as much about vitamin A.
Okay.
Because, well, I shouldn't say that. I would say that like research doesn't know as much about vitamin A.
Yeah.
Like it primarily is used as an intervention as an antiviral, like pre sort of vaccination, pre mid 80s, before there were like measles, mumps, rubella vaccines. If a child showed up in the emergency room with measles, the treatment of choice was to give them like an intramuscular injection of a high dose of vitamin A because it reduces viral replication. So that's the main use of vitamin A. It's also like important for our vision. It's important for like the mucus producing cells of our digestive tract. And then it has an impact like on sebaceous glands. And so, that's why like Accutane, like a synthetic vitamin A, is used to treat like very like cystic type acne. But vitamin A has this like flip side where it has toxicity levels. And because high doses are usually used for, sort of therapeutic interventions, it's a little bit like touchy. I would say there's been like too many cases of vitamin A overload, or definitely for naturopaths and nutritionists to use it like frequently in high doses, and definitely not for long periods of time. And so for that reason, I don't really delve deep into vitamin A because I don't use it very often outside of like really acute doses. If someone has a viral infection, it's very helpful. Or if Accutane is not a good option and they want to use like a non-synthetic vitamin A, it also helps with acne. But I would say the closest relationship is that they both act like antiviral agents. Like they help boost the immune system up in the presence of a viral infection and build the types of immune cells and chemicals that help to like fight very quickly at like the first sign of infection. What relationship do you know? Like, is there something that I don't know? I would love to hear.
Was it like it's like it's in my like maybe when I was reading, it's about Weston A. Price. I think he says to take like your vitamin D with other things.
With other things.
Yeah.
Yeah. He was very much like a whole foods or ancestral eating, right? Like that we like every other culture traditionally, that eating like all parts of the animal, eating whole foods. We didn't really talk about like eating seasonally, but like in traditional diets, you would eat what was in season and like store or pickle or what you could or cure. But animal specifically, like liver, contains quite a bit of vitamin D, vitamin A, zinc, iron, choline, all of these things that are very difficult to get definitely from a plant-based diet, like almost impossible to get enough. And so this is kind of is the sneaky part with vitamin D. Like if you're able to eat an animal protein or an organ meat that has all those nutrients in it, then it is a more like whole foods form.
I myself have learned to put a little bit of liver in like my ground meat. Yeah, and it has reduced.
It's brave. Like it's brave. It's not. That's not that bad, but it is. It has the ick factor, right?
Yeah.
If you haven't like grown up eating it, or you don't know how to cook it. I was listening to another podcast a few months ago about an American woman who moved to France to learn to cook. And so she learned all these cooking practices, but in the process learned how to cook organ meats. And like, so that they were very yummy in a lot of butter and with herbs. And so I think she's writing a book, like a kind of like a travel cookbook, but specifically how to cook like ancestral type, like organ meats and different parts of the animal so that it's very palatable. I can't wait for that.
Yeah.
Like in my notes, very deep to like look back in a couple years when it's published. But there's a few farms in Ottawa, like organic cattle farmers, I don't know, small scale farms that sell, sometimes they call it ancestral ground beef.
Yeah.
And one farm, like Arc Acres, is a female-owned farm, and they sell their ancestral beef has like kidney, heart, and liver from the cow, and they just grind it up into the ground beef, so you don't really taste it. It's a little bit more red, like deeper And Bear Brook Farms sells ground beef. They call it ground beef special or ground beef extra or something. And I think it just has, it's like a third beef heart. And for the farmer, it's good because they're using up something that maybe isn't going to sell. And for the consumer, it's nutritionally more dense.
Yeah.
Yeah. Good for you. There's also some people will take like capsule forms, you know,
Yeah.
like organ dried, like desiccated liver. It's such a small dose though. And then the other kind of strategy is that you just you freeze liver and you chop it up into these like teeny tiny cubes, kind of like a vitamin gummy, and they just like pop them in your mouth. Like for kids, they could do that because you can't really taste it if it's frozen and swallow it. That's the other strategy if you don't like liver or you're not going to make homemade pate. But Lily Nichols, who wrote Real Food for Pregnancy, and she wrote Real Food for Gestational Diabetes, like a prevention, treatment, dietary, like very well-researched dietary book. She's a Weston A. Price like follower, but a registered dietitian. And her, she has a recipe on her website for like beef liver pate it uses a lot of butter, but it's like not so bad. That's if anyone wanted to dabble and try, that would be the recipe I would recommend.
Nice.
But anyway, yeah.
Yeah.
That's it. Like it's sort of the traditionally, you know, like, or I shouldn't say traditionally, like a generation or two ago, the recommendation was to give children cod liver oil. Right? Like everyone in their 70s, 80s talks about, even 60, like talks about their parents like giving them a spoonful of that every morning, and definitely in the winter, because cod liver is very high in vitamin A, vitamin D, and omega-3s. Yeah. And especially in like middle of Canada, like we don't have an ocean. Like we can't get access necessarily to like ocean caught fish.
Right.
Caught fish.
Yeah.
Yeah. So supplementation, I think, was born out of that. And especially for kids, you know, like who need nutrition, like in a different way than adults do, because their bodies are literally doubling in size.
Yeah.
And forming. Yeah.
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 Yeah, my dad grew up on cod liver oil, and he's a very healthy man. So.
N of one, we have like an example. Exactly. My dad eats a can of sardines like every day. And so there's the whole can thing, which like we don't have to talk about, but that's a lot of fish. A lot of omega-3. Yeah. What you gonna do, you know? I think some people can push through and eat things that maybe aren't like ultimate delicious factor for health reasons.
Is it possible to have too many omega-3s?
Oh my gosh, this is a very controversial topic.
Okay.
Okay, so what we think is happening, you know how there's omega-3 oils, there's omega-6 oils, and there's omega-9 oils. Those are like the primary 3 omega. They're like PUFAs, polyunsaturated fatty acids, and they're essential. Like we cannot make them. We have to get them from food, whereas cholesterol we can make. You know, our liver can make cholesterol, or we can eat it in an egg yolk, or a hamburger, but we can't make an omega-3. And so that is why omega-3 supplementation has become so popular, because omega-3s are found in like plankton, algae, fish, flax, sort of it. And like limited breast milk. And omega-6s are found in like a ton of nuts and seeds. So like if you eat almonds and walnuts and tahini and hemp seed and all of these things, you can get access to all of these omega-6 oils as long as they're raw. If you roast a seed or a nut, you know, the oil changes just like as if you cooked it. And so like those raw kind of fresh seeds are a wide source, and there's a teensy bit of omega-6 in like other oils, you know, like vegetable type based oils. And then omega-9 is found in olive oil. And so most people who are on the health train consume a ton of olive oil. as long as it's cold. If it's been modified or it's heated to high heat, the oil changes again. Omega-3s kind of like oxidize quickly, you know, they do. And if you've ever bought a fish oil and taken half the bottle and then left it in the back of your fridge for 7 months and then taken it again, you know what an oxidized oil, like it tastes rancid. And or flax oil, same thing, like it goes bad very quickly. So we need like all 3 categories of those, and within omega-3s and omega-6s there are different categories of specific oils. And so the push in health food has been to consume more omega-3 because it's harder to get from the diet. And this whole idea, like a lot of sort of big time health influencers, like the big podcasters in the US, talk about how omega-3 is the best and anti-inflammatory, and omega-6s are like evil and are inflammatory and they're bad for our health. And so we should be consuming, you know, like a 3-to-1 ratio, 3 times the omega-3 to omega-6. But in reality, our cell membrane, which has a ton of, you know, phospholipids and omega fatty acids included in it, has a 4-to-1 ratio. It's like 4 parts omega-6 to 1 part omega-3. So in theory, if we're like going by what our bodies are using, we probably don't need so much omega-3. And what happens if you supplement with too much omega-3 over a long period of time is you displace some of those omega-6s from the cell membrane, and then you sort of like create a deficiency state unintentionally. And that the worst case scenario on that path is like a demyelination, which is sort of like the characteristic of multiple sclerosis, where the nerves that are coated in like a fat, like several layers of like a fat coat, it helps with like the speed of transmission, you know, just like how a wire, if it's more insulated, will have like a faster current. If your nerves start to demyelinate, then the current can't, you know, it's like a skipping. And then there's some it's like the start of a neurological condition, and it's not necessarily reversible. So that's the like worst case scenario. I wouldn't say that applies to most people, but that's sort of the big fear of like too much omega-3 emphasis, or this like demonizing of like good quality omega-6s. But, you know, like cottonseed and processed canola oil and palm oils, like all of those fall into that omega-6, like vegetable oils or industrial seed oils category. And for whatever reason, hemp seed and almonds and things have been like clustered in the same category, but they're not the same thing.
Yeah. Okay.
Anyway,
So just
a
avoid.
long-winded answer.
Yeah. It's like basically just avoid doing too much
Too
supplementation.
much of one thing. Yeah, it's like too much of one thing, not enough of another.
Just like the same for everything.
The same principle as everything else in health and life. But it is interesting, you know, like if you look at a culture that eats like black beans and pinto beans and corn and quinoa and, you know, like a few grains and a few beans and lentils, and then like maybe chicken eggs or chickens, like one animal protein source, and then seasonal vegetables. Like if you sort of were eating like a traditional diet in one area of the world, like what's accessible, it's interesting that like nutritional needs are met. Like people have figured out over time, cultures have figured out over time how to not get sick and how to meet their nutritional needs. And because we've sort of shuffled around the world and we have grocery stores where you can buy everything, you know, we eat what's delicious. We don't necessarily, and what we're used to, we don't necessarily eat what's like available to us like locally and seasonally. And so I think by like convenience, we've sort of accidentally driven ourselves into a bit of like a nutritional depletion state, and like it's hard to have a balanced diet outside of like a broad knowledge of nutrition. You know, and I think that's why it feels so complicated. Like, do I eat this? Do I not eat this? Is this bad for me? Is this not bad for me? Like, what do I it feels overwhelming for I think a lot of people, especially if you don't feel well. But in theory, it doesn't have to be complicated.
Yeah.
Yeah.
Okay. So just avoid.
Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah. Just avoid. Yeah, it's much more complicated with like a vegan diet, I would say. It's really hard to meet like the omega needs on a vegan diet because some of those are only found in animal products.
Mm.
But that's tricky. It's a whole other can of worms.
Yeah.
Mhm. Yeah, good for the planet. Just harder for the body.
Yeah.
Yeah.
Um, Going back to the sun exposure,
Yes.
lots of like I like rarely see kids like really exposed to the sun, and I know there's controversies around it and we want to protect our son or like everyone from like
From sunburn and skin
yeah.
cancer. Yeah.
Mhm.
Hmm.
How do we manage that, and what are the benefits of getting some sun, and
Yeah.
where's the balance with the sunshine?
Yeah, with the sunshine. I think that is a difficult answer because everyone's skin is different
Mhm.
and our geographical location, depending on the time of year, is different. So if someone is in Panama with really fair skin, there's, in research, they categorize skin by like types,
Mhm.
type 1, type 4, and but if really fair skin, you let in, your body doesn't need as much sunlight for melanin to get produced and then for vitamin D synthesis to happen. And so probably like the earlier part of the day, like 9, 10 o'clock, like before that, like we call it short shadow sun, where the sun is like high up in the air and your shadow is really short versus like at 5 or 6 p.m. when their shadows like really elongate because the sun's lower in the sky. So like longer shadows, sunlight is better for people with really fair skin, whereas people with darker skin, especially living like at more northern latitudes, require a longer sun exposure and can probably manage to be in the sun without that feeling of a burn in the middle part of the day for a longer period of time. So that's sort of the tricky part, is there isn't like a one exact, like 30 minutes of between 10 and 11
Mhm.
for everybody. But definitely in the winter in Ottawa, especially, like we can barely synthesize vitamin D, especially if we have like this much skin showing.
Yeah.
We're walking to work or something and it's minus 35. It's like impossible. It's still good for our eyes to see the sunlight. Like there's a whole host of like circadian rhythm, downstream hormone effects from that. And so going outside, even if you're just like shuffling some snow around in the winter or like pulling some weeds out in the summer, like at 7 o'clock in the morning, is still a really good thing to do without sunglasses on for non-vitamin D reasons.
Yeah.
But for vitamin D synthesis, it's all different. I recommend for patients, there's an app called Circadian. Have you heard of this?
No.
The icon is like a little C. It's a cute, and it was developed by a woman named Sarah Kleiner, and she's a nutritionist, personal trainer in the U.S. who very much follows these circadian rhythm principles. And she's super hardworking and she's very analytical. And so I think she was coaching her clients on when to eat breakfast based on the sunlight, when to eat, when to be exposed to the sun, when the best time to exercise is for like our energy levels and our cortisol, like all of these things. And she developed an app, which is, it knows where you are geographically and you say where you live sort of thing. And then every morning it will tell you like when the sun rises and when like solar noon is and when sunset and dawn. So you kind of at least know when the sun is going to be up. Or if you're trying to catch the 10-degree, like right after sunrise sun, like Andrew Huberman recommends, that early morning sunlight for a good cortisol surge, then you kind of know when to wake up. and then she has all these extra add-ons about skin type and time in the sun for optimal vitamin D synthesis. And she has like programmed all of that into her app, which is very cool. And she really relies a lot on research. So I trust her. And there's another woman named Carrie Bennett, who's a nutritionist in, I think, Michigan. And she's also, she's a nutritionist, massage therapist, sort of like athletic therapist. And she talks a lot about like circadian health. And they both have all these online programs that they've developed at very, very low prices. So if that's very interesting, like if you don't want to listen to a 4-hour Andrew Huberman podcast about something very specific about circadian rhythm, these are both like female. They talk about circadian rhythm in terms of trying to get pregnant, in terms of like hormonal health, in terms of weight management, optimal energy, thyroid health, adrenal health, those sorts of things, like makes it feel a little bit more relevant to us versus like biohacking. Which is fun.
Yeah.
But for the general population, we just want to feel okay and like not have a crash at 2 p.m. Yeah. Does that answer the question?
It gives us good resources. Yeah.
I think like you spend as much time outside as you can without burning. And if you have really fair skin, or if your 7-year-old is going to summer camp and they're going to be outside for 7 hours, like you slather them in sunscreen or swim shirts or some sort of clothing that's going to help block like the UVA, UVB. But sunscreen will block the UVB, just like a window. Like some of my patients, I'm like, can you sit outside in the morning and drink your tea or coffee just for like 5 minutes, 10 minutes? And they're like, I sit by the window. Is the window open? That doesn't count. Like just like a cat, like being in a sunbeam, it doesn't count. The like window, especially like double, triple pane windows, will block like UV light. Most of the light, and so we need to actually go outside, or you really need to like open your window and have the screen and be sitting like in the sun.
What do you think of sunscreen?
I think that like mineral-based sunscreens are like likely safe. I think that whatever we put on our skin, some of that does get absorbed. Although minerals, tend to sit on top. They're too big to absorb, so they tend to sit more on top of the skin. That's why they're so white. All those natural sunscreens, they're really like, or remember like the zinc sticks?
Yeah,
like purple and pink and white. It was like a football player, but that is the best sun blocking, is something that stays relatively white on the surface of your skin. It's reflecting. We probably have not nailed sunscreen, like from a safety perspective, but who knows, right? Because people who manufacture sunscreens and the studies on sunscreen ingredients are done by the manufacturers. It's not really done by like third party. And it's such a small exposure over a long period of time, just like every other chemical or, synthetic ingredient. It's very hard to say like what the impact of that is on our health. But like I use sunscreen. I would much rather, on places that I know are going to get like hit often with sun, and like a big hat, and usually like a high neck and all the things if it's like a long day in the sun. But if I go out to garden for 45 minutes and it's 9 a.m, like I don't put sunscreen.
To get
for me personally, because I know I'm not going to burn, and I know it's like a trade-off, right? Like how much are you willing to like a little bit of vitamin D absorption, a little bit of like happiness factor from the sun. And then there's this really interesting, did you see that study that grouped, I think it was in a Nordic country, like Sweden or Norway or Denmark?
It was on women?
It was in the last 3 months that it was published, and it was about skin cancer rates, I think specifically in women. And it separated women into 3 categories. Like the first group of women were people who were like non-sunners, like they did not go outside often, and they wore sunscreen like it was their job. So very low sun exposure. The second category was medium, and then the third category were like the sun worshipers that like bronzed and were outside all the time and really didn't like focus on sunscreen or covering up. And the group who spent more time in the sun had the lowest rates of cancer. A variety of different forms, which is very interesting, because we do know that like it's like sunlight has some forms of, it's radiation in some ways, and so if our skin is protected by tan and bronzing, we can usually manage it. But like strong sun exposure, or if something's not quite working properly in our body and we have too much sun exposure, obviously that can like damage the skin.
Yeah. So it's really about knowing your body and then just avoiding burning and then
avoiding burning, and sort of that whole idea of sort of starting in the early part of the spring, summer, like with low exposure and helping to become like a raisin, but like being able to tolerate more and more sun. I think the big risk is like sort of a Canadian going to like, Dominican for 2 weeks and getting like singed. Our body's like not used to it. Our brains think that we're living in a northern latitude. We're not prepared. Mm-hmm.
Yeah, that resonates. Yeah, I don't burn here, but I can burn when I'm near the equator. Yeah.
Absolutely.
Yeah.
Absolutely. Yeah.
Yeah.
Yeah, I know. And I think we can like adapt to different areas of the world, but yeah. There's a doctor in Alberta. He's like just recently closed his practice. His name's Bruce Hoffman, and he treats a lot of like chronic complex illness, like very chronic fatigue syndromes, chronic pain, bizarre neurodegenerative diseases. And he used to recommend to his patients to move like for the winter, like to relocate, like to snowbird to somewhere where they could be outside, where they could have like bare feet on the grass or the sand, to be a little bit closer to nature for the probably mostly for the sunlight benefits, but also to be able to eat food that is grown locally and, not just, in Canada, we sort of have like potatoes, carrots, onions, and beef.
Yeah.
If we were really eating seasonally.
Okay, so how do we test ourselves and what should be the levels that we're looking for?
Okay, yeah, that's a quick one.
Mm-hmm.
So the standard vitamin D test is called vitamin D 25 hydroxy, like 25-OH. And it's just a simple blood test. It's not covered by OHIP if you're in Ontario. It's not covered by RAMQ in Quebec either. But if you had tested, there was a period of time in like the 2000s where vitamin D testing was funded publicly for everybody. But so many people tested low that, the recommendation was to just everyone should supplement and we're not going to pay for testing anymore. But if you had tested in that window and you were low, the government will continue to fund your testing ongoing to monitor. It's the one like sneaky caveat. Otherwise, you can pay out of pocket for vitamin D. So if you see a naturopath and they run blood work, it's private pay. Like you basically pay the naturopath and we pay the lab dollar for dollar. And vitamin D through Somerset Health, where I work, every clinic has a different price list from Dynacare and Life Labs. It's a little sneaky. Depending on the size of your clinic, you get a better deal. But vitamin D is approximately between $50 and $55, depending on where you go. Okay. Sometimes more. A veterinarian will charge more than that. But through the province, like you can also ask your family doctor if you're going for regular, like an iron checkup or to check your cholesterol levels or whatever it is, you can ask to add on vitamin D, and it will say on the requisition, like vitamin D uninsured. And then you get there and Dynacare basically sends you a $50 invoice after. Yeah. So if you really want to know, you can test it. There's a secondary test called vitamin D 1-25 hydroxy. And that some functional medicine practitioners or naturopaths test both vitamin D. Vitamin D, the first one is activated at the liver, and then it then goes to the kidney and gets like this kind of second little thing added onto it. It's like a second level of activation so that it can work properly. But that test is significantly more expensive. I think it's like double or triple. Okay. And so because of the cost, we don't usually test that 125 hydroxy vitamin D. We test the like typical, and most research tracks levels of the 25 hydroxy, like the typical test. And then the range will say, like if you get your results from Dynacare or Life Labs, it will say if you're between 25 and 75, 74, you're in like a suboptimal or like deficient, possible deficiency range. 75 to 250 is considered, it's like a huge range, but that's considered the healthy range. And then above 250 is considered dangerous vitamin D toxicity, like stop supplementing. What the heck is going on? And then functional medicine doctors generally say you want to be kind of between 125 and 150 for like osteoporosis prevention and optimal hormone support and it's actually like quite difficult to get that level if you don't like work outside. You don't spend a ton of time. And let's say we have between May and end of September to kind of like build up our vitamin D reservoir so that we have some left for the winter months. It does actually require like quite a bit of time outside, and that's why supplementation is so popular. I would say like my patients who mostly live in Ottawa, between the ages of 7 and 85, usually vitamin D comes back in the range of like 45 to 65. Like I would say 80% of people fall in like the deficiency category, like according to the lab. And then another 15% fall into like under 100, but somewhere between 60 and 100. And usually there are some people who are like genetically gifted, I think, who have really great vitamin D levels and sort of in the mid 100s. And some people supplement significantly, and their levels will get into that level too.
Yeah. To get to those like 125 to 150, I take 4,000 in the winter.
Yeah.
Yeah.
It's not so bad. Like 2,000 or 3,000? What did you say?
4,000.
4,000. Yeah. That's what there was a period of time where, and I don't know what their recommendation is, like their position, but the Canadian Cancer Society in like the 2013, 2014, their recommendation was for maintenance somewhere between 2,000 and 4,000 units of vitamin D. And not even in the winter, just like maintenance levels to maintain your existing level. So if your level is 70, that would like keep you at steady 70. And so some people really that's why there's these prescription levels of vitamin D where people will take high doses of it, because to jump between 70 and like 125, it might require like 10,000 units weekly or daily.
Yeah.
And it's not speedy. It might take like 2-3 months or longer to get to that level. The tricky part is to know where you're at. You need to test.
Exactly.
And so it's then like another cost, but that's the only way to know. We can't like guess the vitamin D levels, and there isn't like a little poke test that you can mail in. Unfortunately, not yet. And then there's a whole bunch of things that interfere with vitamin D status. When people have a lot of inflammation, autoimmune conditions, chronic illness, mold exposure, their vitamin D, even if they're taking supplements, eating foods that contain vitamin D, like almond milk is fortified with vitamin D, mushrooms contain a little bit of vitamin D, animal products contain some vitamin D, they might, and they're spending lots of time in the sun, their level might just stay at like 45 after like 3 or 4 or 5 test results, like over the course of a year. And that's really like defeating, I think. And so for those patients, we try to figure out like what the cause of inflammation is. And second, you can do vitamin D injections into like the muscle. It's an oil, so it's a little bit of a bigger gauge needle, but usually it's into like the glute. And that is a way to like bypass the digestive tract and to get like a big dose in relatively quickly. We don't do that. Like it's not common. Most people respond well to oral vitamin D supplementation, but I would recommend especially if you're taking a high dose, like above that 5,000 international units, longer than 6 months to retest.
Yeah.
So that you're not overdoing it, because that does happen. Like we see at the clinic, I would say maybe 5 or 6 times a year, patients that are like above 250, and it's alarming. Like, nobody wants to overdo a supplement. And so that's important to test for sure. Same with iron. If you're taking a high dose iron for a year, you would retest it because you don't want to have like an overload situation.
Yeah. Yeah, totally. I test it. Like, I know that it's like the perfect amount for me because I've tested a few times. Yeah.
Yeah.
I try to
And
test
you
every
sort of get
2
used to
years
it.
now.
You know, if your habits aren't changing and like seasonally you're sort of doing the same things and your diet's not changing, like your body will probably be doing the same thing year after year. Same with me. I can remember like one summer I was swimming outside. Like there was like a lap pool outside and I was playing a lot of tennis and like I had a tan. And I was taking like maybe 3 days a week, I would take a full dropper of vitamin D. So whatever that is, like 12 drops. So 12,000 international units. So it's a high dose half of the time. And then I tested like mid-September and my levels were only like 109 or something. Like I was surprised that they weren't higher.
Yeah.
And so that was a little bit of like a shock to me. I still might not recommend high dose oral supplementation to my patients just because it makes me a bit nervous, but for myself, I might take a higher dose.
Yeah.
Because I've tested now, I know.
Right. Yeah. Because now you have a baseline knowledge about your body.
Like an increased need and yeah.
Yeah. Nice. I really love how you answer, and it's like there's no one size fits all, and I feel that that's really healthier than some other things that are like, you must do this.
We must do this. Yeah.
Yeah.
I feel like that is dangerous as a practitioner to say you must do this. Like, it's not like people are adults. Like, you can't tell them what to do. We're like providing guidance. And I think as we have learned many times over in medical science, like we think something is true and then we study it in a different way and it is found to not be true at all, or if anything dangerous. And then we like backtrack and try to figure it out. And so, I think we can trust a lot of medical research, but studies look at one specific thing. They don't look at like everybody. They don't study children often. They don't study pregnant women often.
Yeah.
They don't study the elderly very often. And we all have different genetics. And so we all respond differently to our environment and our foods and supplementation and medication. It's like impossible to say this one thing. Like statistically, you could say 30% of people benefit from this, whatever intervention, but it's impossible,
Yeah.
Yeah, I think the more like dogmatic something is, the less you should trust it.
Yeah.
When it comes to health, because we're all just like guessing a little bit. Yeah.
Yeah, that's how I feel about midwifery and the recommendations that I used to give. Yeah. That's very
They
one.
change, right? They change. The
Oh, that's so
recommendations with aspirin have changed like over the course of, I don't know what else.
induction. The diagnosis for diabetes is now different. So we induced everyone with diabetes at some point, and that wasn't the case necessarily, because there's different types of diabetes. We have a stricter guideline, stricter cutoff for what diabetes is. We induce everyone for obesity, a BMI of 40, age now. That wasn't the case like just like a decade ago. There's other things.
And I think like in big organizations, like when you're part of a profession and with medicine, because like one individual doctor or midwife or nurse or naturopath, like we can't know everything.
Yeah.
And so they make guidelines for like ease and speed of practice and like for general, like statistically for like the general population, weighing like pros and cons. But when it's with our bodies, it's different. It's not like buying like this air purifier versus this. It's not like a commodity.
Yeah.
It's like a very personal choice.
Exactly.
I think people do have like an intuition about what's good for them, what's not good for them, if they're paying attention. And conventional medicine doesn't have time for that, usually. It just takes more time. Yeah.
People, just because they think that they're high risk, let's say with age, then the decision they make is from fear rather than from intuition. And when you look at data, like there's some people who really aren't at risk of what we tell them that they're at risk for. And I really love how you're presenting information. It's really it's wholesome. It feels good in my heart.
It's very similar. Hey, midwifery and naturopathic medicine have like similar, like very similar, like informed consent. And
I would
like
say that
patient
midwifery has
first.
become a lot more medical too. Like, yeah,
Because of like liability or
fear, and even though there's good things about liability as well, and like taking on the responsibility of what you're telling people, but then we just don't have time to look at research beyond the guidelines, and we're not very skeptical of things that are being told to us. And we just like base it on one case that happened in the US where someone got sued, and we're like, and we don't even know the outcome of that court case, and we still were changing what we're doing and in putting fear into the other baby catchers. Like I've seen it, so it's it's how I feel.
Baby catchers, like dream catchers.
Yeah, dream catchers. Yeah. Let me see if I have other questions about vitamin D. So newborns. So like so this is what I think, but I have no evidence of it. Is just that if a mom has really good vitamin D levels that are, let's say, above 125, but you can change that. And then she's breastfeeding, that baby doesn't need supplementation. And because most people don't test at all, we're just telling people to give like a smaller dropper, so like a 400 international unit to babies every day after birth.
Yes, and for the first year of life, usually, like the whole first year of life.
If you were to do it, like let's say you had me and I'm like super gung ho about like having good health, and I keep my vitamin D levels up, like what would you like tell me to do that might be a bit different from that recommendations? Like I would want to pay to know what's optimal for me.
Yeah, if you had tested your levels and you were continuing to sort of like eat in a similar way or supplement or have sun exposure, I would say like it's up to you. I would say the guideline is for all babies to supplement with 400 international units daily. No woman remembers or family remembers to give their baby a supplement every day. I could say that confidently. So most babies are getting their vitamin D drop like twice a week. I would say based on my patient reporting, my patient population reporting, and they're just fine, you know. But there are other ways, you know. I would say walk outside with your baby, and like they can have a little bit of like their little legs and arms exposed to sunlight for short periods of time. I'm not gonna like, you know, melt if they get exposed to a bit of sunlight, but they will burn quickly. And yeah, I would say it's your choice. I mean, some people will start, if they, let's say they start food introduction at 4 months or 5 months, and they decide that they want to, like, let's say they're pescatarian and they give their baby like salmon on month 6, they might start supplementing with cod liver oil at 6 months instead of vitamin D, like drop. You know, they might use like a whole foods source. And then on the flip side, there are some babies who are very sensitive to dairy, or they're sensitive to their, you know, they're formula fed, but they can't have cow milk dairy or goat milk formula. Their moms might not be able to have any dairy, and maybe they're vegetarian. And so those babies, sometimes the parent will choose to supplement like 3,000 units for their infant until, you know, they're able to do a test or something. And so that's a tricky one. I think we definitely don't want low vitamin D status in little ones, but I don't think supplementing is the only way. It's selective.
If we were to test a baby, would it still be like 120?
Yeah, they have reference ranges. Babies have unique reference ranges for all sorts of things. And so I'm not exactly sure. I very rarely do blood work with babies. But usually Geo does it, and then I see their results. But even then, they're not testing vitamin D routinely unless the baby's not growing or is having some sort of mineralization, like our bone concern. It's not like a standard of practice.
Yeah.
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 Maybe in a 5-year-old or something, but
Yeah.
not in a little one. Yeah.
Yeah.
I know. I think the tendency is to feel, especially if you're sort of more naturally inclined to feel like not the supplement, right? Like it's like that's synthetic. I don't know what it's going to do. And like I can relate to that. And then there's sort of this like just in case. It's kind of like a prenatal, like I would say that a small amount of vitamin D for a baby is almost like a little prenatal dose. It's like this just in case we're covering our bases. It's probably not going to like build up their levels significantly.
Yeah.
But it may reduce their chance of eczema or seasonal allergies when they're 7 years old or something. Yeah. We don't know. Yeah. Yeah. But it has a low risk, it's a low danger factor.
Yeah, it's small. Like even that, I thought that the recommendation for adults, and I'm not sure where this comes from, was 1,000, and I always felt that was like really low.
It is low.
Yeah.
And patients will say, I'm like, do you want to test your vitamin D levels? You have like mild to moderate depression. Do you want to check? And we'll say, oh, I take 1,000 units. I don't need to. I'm like, okay. Sometimes I say, okay. And sometimes I think like, we should check anyway and see whether the 1,000 is doing what you think it's doing.
Yeah.
Because there's so much variability, like person to person. Yeah.
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 All right. Is there anything else you want to say about vitamin D or sun or anything like that?
I don't know. Mostly that the sun is the best. I like definitely in moderation, but it's not this. We probably think we're taking vitamin D and getting like all of the benefits of having adequate vitamin D stores. But when our body makes it ourselves, really, we are like meeting all our needs. And through supplementation, it is probably acting like an anti-inflammatory and helping with our calcium absorption, all of those things. But it probably isn't having the broadest, best impact compared to like naturally synthesized vitamin D. And the other thing that I was going to look up, and then I thought about it in the middle of the night, like, oh, I wonder. And then obviously, like, I didn't want to turn on my computer. But is that because vitamin D is like a cholesterol backbone molecule, it's built upon cholesterol. Like, what about the millions of people that take statin medication that lowers their cholesterol levels, like especially people in the 45, 55 plus crowd? Like, is that impacting our vitamin D status? Is like that impacting then our inflammatory levels or our bone health levels or our other hormone levels? And I don't know if that's been studied. I haven't looked, but I would be curious about that because they're becoming more and more popular. Like, as you said, with midwifery guidelines, they've become stricter. Like the level, the threshold for intervening medically is lower. It's the same with statin and cholesterol levels. They have since I started practicing in 2013, and I would say total cholesterol, the range has decreased by almost 1 full point. It's much narrower. And so the threshold to recommend a cholesterol lowering medication, a statin, has become, it's earlier and earlier in people's sort of aging process. And so that's concerning to me because there's so many people taking statin medication. Not that it's necessarily terrible, but that we need cholesterol, and statins interfere with cholesterol manufacturing. And not just the cardiovascular cholesterol, all of it. So I don't know. It's kind of that trade-off. Is it counterproductive or is it worth it? Or yeah. But otherwise, in a perfect world, we would live in a little bit more harmony with nature. We wouldn't live in little boxes with fluorescent lights with our computers on 8 hours a day and then on screens. In a perfect world, I think it is partly a contributor to people's decline in health.
Yeah.
Probably bigger than we give it credit for.
Oh yeah.
But that's hard to study.
Yeah. Who are you gonna make live outside?
I was gonna say exactly. I'll volunteer for Is that the placebo group, or is the placebo group the computer group? We definitely know, like there's a Canadian researcher who wrote a book called The Siesta and the Midnight Sun. And it's a book about circadian rhythm. It's like 15 or 18 years old. And she wrote the book like for the lay person after finishing her PhD, or maybe during her PhD. And she highlights a study. I'm going to get the details wrong for sure. But they basically like studied, I think, men in like a cave type environment. Like there was no sunlight. And they started to act like sleep and wake on a longer cycle than a 24-hour cycle. So it's something like a 28 or 29-hour day. You would sleep like longer, wake up and have, you know, the same amount of waking hours, but sleep in later. It's like, I remember thinking like that, feeling like you never have enough time in the day. Like maybe our bodies naturally without sunlight, like kick in, we have a longer day or a longer sleep. But without the sunlight, like that's our main signal. Like our bodies don't know to just wake up. Our bodies don't know when to make thyroid hormone, when to make cortisol, when to do all of these things without like sunlight and sheer darkness as the two like prevailing time signals. They're like the, you know, we call them like the primary hormone triggers, and then all our other hormones basically like stack and line up following those two signals. And so if your room is bright at night, if you have your like TV on while you're sleeping, if you're like a street light is like shining in through your window, like your brain can see it. You know, your skin's detecting that there's light. And so we're definitely not like in deep sleep. And then the other thing that is like, again, slightly controversial, and I would say maybe newer, is this idea that like in the summer we have vitamin D levels that are higher from sunlight exposure. And that's what acts as the primary anti-inflammatory in our body. And then in the winter, when there's more darkness, we have more melatonin circulating. And so maybe we don't need as much vitamin D in the winter. Maybe melatonin can take on some of those roles in terms of immune regulation. And maybe that's how our bodies are like primed to operate. Like maybe we're sort of like missed half of the story.
Okay.
But I don't know. Stay tuned on that one. Yeah.
Yeah, we haven't gotten there yet.
Yeah, exactly. It's kind of exciting. There's more to learn. Yeah.
Yeah. We've evolved with the sun. We've evolved with all these things, and the way of living, it feels really normal to us because that's all we know. But
and it's maybe changed quite quickly in like a short period of time. But it's not like other mammals are taking vitamin D supplements.
Yeah.
You know, they live outside.
Yeah.
They're just fine.
Yeah.
Yeah, just us. We're sort of like supplementing ourselves out of like our natural environment. Yeah. Yeah. Mm-hmm. Thanks for all the questions, Leanne.
Yeah, that was super informative. Yeah. Thank you, Erin.
I'll talk to you soon.
Yes. Bye.